The COVID-19 pandemic has affected many things in many ways. Last year, researchers within the University of Nottingham found that many aspects of cybersecurity within the healthcare industry were affected in many ways throughout the pandemic. The paper they produced illustrates these changes and attempts to provide some suitable solutions. The paper identifies 9 of the main cybersecurity challenges that were present during the pandemic, along with 11 solutions to these challenges. Along with this, research was also conducted into the most prominent and significant methods of cyber attacks that occurred, these being phishing, ransomware, distributed denial of service, and malware attacks. Articles were located within 2 sources, PubMed and Scopus, both of which are literature databases commonly used by researchers within the healthcare industry. A search criteria was utilised and only articles written within the last year and relevant to healthcare cybersecurity were considered to keep things relevant. The findings from the research conducted shows that changes within the healthcare industry had a knock-on effect on security and therefore vulnerability to cyber attacks. Firstly, decreased mobility during the pandemic, especially with border closures, increased the reliance on remote working. Secondly, during this time, many new technologies were introduced. Thirdly, the healthcare industry in general has limited experience working remotely when compared with other sectors. Along with this, the healthcare sector has an overall lack of digital literacy among its staff when compared with other industries. Finally, the increase in reliance on PPE made the service more susceptible to phishing attacks, such as email scams which attempt to steal sensitive information. Many solutions arose from the research, most of which are listed here. Many of these solutions involve direct action from IT departments to implement more secure working environments. These efforts enforce security protocols, therefore preventing user errors and reducing the amount of end-user involvement. The other solutions involve distributing information and training end users to ensure that they are aware of the correct security practices. Thank you for watching.